Hey everybody, welcome back. Definitely doing this on the fly again. I'm going to post up a video tomorrow for the FabFit Fun, but I wanted to do another update this week on what it's like with the coronavirus here, specifically in San Antonio, what my experience is as an ER physician. It's been a weird week. It's been a week of like ups and downs. We have seen some days where a lot of people are coming in with respiratory symptoms, and we have seen some days where I'm not seeing any. My hospital has several patients on the vent right now, and people that have been in the hospital for weeks and are on the ventilator for, a couple weeks. Thank you, folks that are commenting. I may or may not respond down below as I see them, but yes, we are staying safe. I was going to go over some of my protective gear that it's kind of changed up a little bit, and kind of where we are in this pandemic. So I have seen probably, I know of at least 10 confirmed cases myself, but there's probably many, many, many more. Some of the patients I've taken care of have done well. Some are currently in the ICU on a ventilator, and it's pretty scary stuff. Those folks, we're trying everything, and they're not improving. It's kind of devastating to see what these young people are going through. And when I say young, most of our people on a ventilator are 40s plus, which to me is still quite young. So that is what we're seeing right now. I'm still seeing a wide variety of really weird symptoms. Obviously the cough and weakness and fatigue and chills and all of that, but you're also seeing people that present just very weirdly. One of the weird symptoms is insomnia, which if you've never heard that term, that's where people lose their ability to smell and their taste goes. And that is a weird symptom that we're seeing. I actually took care of someone the other day that had that and then finally tested positive. We're still having huge lag time on our testing. Unfortunately, we're getting a little bit faster, and there's a new test coming out, hopefully, that our hospital will get in another week that will allow us to turn around tests longer than a day or two. I still can't test people outpatient, which is very frustrating, but San Antonio at least has opened up the testing where you don't need a doctor's order if you meet certain criteria. So hopefully in other communities, the testing is going to get better, which is going to help. So we have a better grasp on how many people we really have. I wanted to show you guys some new gear here that I got that I'm super excited about. I'm kind of hearing rumors that we won't have enough protective gear for everybody, and they're kind of letting the docs know that they probably need to have their own gear, which is really disconcerting. Luckily, I'm kind of paranoid, and I started trying to get gear back in January and February when I saw this coming. So one of the big things here is these are my goggles that I wear. These are when I am in with a suspected patient or somebody that I think I'm gonna need to intubate. These actually seal up to my face. They do hurt because I have to put a lot of pressure on them, but they work really well. And then this is the thing I'm most excited about for intubation, and that's where you put a tube down to put someone on a ventilator. We have those big, like Ebola looking suits that they're called PAPRs, a purified air positive something respirator. Basically, it blows positive pressure, and it has a P100 filter on the back, and that filter filters out 99.97 of bacteria and viruses. The problem is that setup takes forever to put on, and I don't want to watch my patients die while I get in protective gear. I was able to get my hands on this, and a lot of you guys may see something similar to this. This is like your generic face painting mask or respirator. Mine is actually a healthcare grade one. I don't know how I got my hands on this one, but it has the same filter on it that you would get for like that big Ebola suit. The only difference is it only goes right here. So this allows me to get suited up and suited out really quick so that I can get in and put a tube down my patient's throat, or go in and do CPR and not expose myself and still save them. So that's very good. I see a lot of you guys are commenting. I'm on my tablet, so I'm having a hard time reading it, but I'm definitely going to look back through, and I'm really excited that you guys are commenting. Anyway, this is reusable, and I can reuse this, I believe, for up for 60 days per filter. So I'm super excited about this. I was getting really, really, really scared about how I was going to take care of my patients and stay safe, but I got a hold of these. So that is that. Um, Other things, it's weird in the ER right now. We're volumes are down. We're saying this is like the calm before the storm, or like the water going out before the tsunami. I know that some of the other communities in Texas, we're starting to see a huge uptick in admitted patients. From friends that work in ICUs in Houston, I'm hearing that their volumes are going really high. Houston's only 2 hours away from us. So I know it's coming. And like I said, we have days where it's not too bad here and days where it's busy. Here in San Antonio, I think I get reports because I'm a medical director, so I get a lot of the inside reports of what's going on. But I believe think there's like 30 or 40 patients vented in the city. And then there's, I believe, somewhere around 90 plus that are in the ICU. Our confirmed cases have definitely gone up. I think we're getting close to 400-ish. I haven't looked this morning. Overall, Texas, we're looking at four or eight, 5,000. We're getting up there. And our overall deaths are over 100. So we're definitely getting busier here. And if you look at the totals for the US, I mean, we're over 200,000. Our death rate, I believe, is somewhere in, I think it was 8,000. So you're starting to see, as these cases go up, as people have had this longer, you're starting to see more people on the ventilator, and then the death rate kind of lags. So we're nowhere near Italy, thankfully. Italy has like a 10% death rate. We're looking closer to like the 1 to 2%. And I suspect if we could more broadly test, we're a little bit lower, but it's still devastating. And at the end of the day, we're projected or modeled to have upwards of 100,000 or more deaths. So this social isolation is so important, staying your distance. They are showing in places like California that it is actually helping flatten that curve. So when we say flatten that curve, usually what it is if everything hits at once, you have this huge spike in cases and a lot of people coming in, and it overwhelms the hospital system like it is doing in New York. And then they have to pick and choose who they put on the ventilator and who they let live. If you can keep people home, that decreases how fast they hit the hospital and kind of pushes it over a long period of time. And so that helps have those ventilators and things available for when those people get sick. And yes, some people are arguing it's going to delay how long we have it. But I think we need to face the new reality that this disease is in our population. It's not going anywhere. Even if it starts to ease up this summer, we're probably going to see an upswing of it again in the winter. But hopefully this will get us through that first major hurdle. And then we can kind of figure out things like vaccines and that. So some treatment modalities we're not seeing a lot of success or mixed reviews on the chloroquine, sorry, I can never say that. Same with azithromycin. Some places are reporting it's good. Personally, at my hospital, we're not seeing great outcomes with it. And, we put people on it pretty orally. We cannot get our hands on some of the other antivirals that are really, really showing promise. There's one that they did for Ebola that is showing a lot of promise, and nobody can get their hands on it. It's a trial. You have to have end stage. People basically have to be about to die and they release it, but they're overwhelmed with the number of requests. We're seeing a lot of success in what's called proning, where basically you put a person on their stomach to help ventilate them. And so when you put a tube down, you put them on the ventilator, usually you imagine people are laying on their back. But if you flip them over, that allows their lungs to both expand and what we call recruit more, meaning it gets more ability to get oxygen into their bloodstream. We're seeing a lot of success with that. And in fact, some studies are showing they're doing it with people who are not on the ventilator and it's helping. So we're seeing that. We're also finding out we don't want to give people a lot of fluids. People get overwhelmed, their lungs fill up with fluids. We actually want to keep them from having a lot of fluids. So these are things, it's a lot of supportive treatment is what we're seeing. Vaccines are in trials right now, and so supposedly it's having a lot of success. But I think realistically, we're still out at a minimum 7 to 8 months before we see a vaccine come our way. Um, and I think once we get that vaccine, that will be a good turning point. But it's going to be a rough road before we get there. The other thing is there's an interesting study, and I'm going to be watching this, and I'll let you guys know what I think when I see it. But BCG vaccine, that's a vaccine a lot of third world countries use to protect against TB. We don't use it here in the US because if anyone has ever had to get a TB test, if you've had that vaccine, it negates that test. Here in the US, we have so little TB that we opt to not use that vaccine, so we can survey with the test instead that you get. However, they're showing in countries where that is more routine that they're seeing this pattern where it may be protective. And so that is a vaccine that's been around forever that might possibly have some effect to prevent or help people. So I'm really curious about that. They're talking about if it does truly show help, that they'll start with the first liners and doctors and everyone. And I, for one, would be one of the first to step up and get that. I'm a big proponent of vaccination. So yeah, that's where we are at right now. It's still every day is new information. We used to think that it only really affected the elderly. We're now seeing deaths in children, which is probably one of the most terrifying things. I am terrified of giving it to my parents, who are at a at-risk group. But now the idea that I've seen people and colleagues post on forums that I am on showing their 9-year-old children in the hospital on, oxygen with this disease. And that terrifies me because I don't want to bring it home to my children. And I don't think anyone wants to bring it home to your children. It's bad enough when you see your grandmother get sick and die from this, but the thought that it could potentially cause your child to be severely ill or die is terrifying to most everybody. So that's a little bit scary. That's something we didn't see out of the initial data out of China, but we're now seeing in the US. We've had a couple pediatric deaths of some babies and of some children that are a little bit older, 13, 15, 16. We're seeing deaths in 20-year-olds, and it's not necessarily ones that have health problems. So, although the younger folks tend to be protected, we're still seeing people die from it who otherwise shouldn't or don't meet that statistics that everybody's been touting. So that is scary. Okay, that's depressing. But on another note, I do think one thing I wanted to talk about is in the news, they've been talking about now they're advising for face masks, or a lot of communities are advising you wear face masks out and about. I actually do think this is a good policy. Reason is that there's a huge proponent of people that are asymptomatic carriers. And what the masks do are not protect you from getting the virus, but if everybody wears it when they go out, it protects you from transmitting it. So if you're an asymptomatic carrier, you're not going to give it to someone else. So if everybody theoretically wears a mask, that protects everybody else. Please, please, please don't use an N95 if you have it. Donate it to one of your local healthcare people. We are in desperate need of those. An everyday person is not fitted for those masks correctly. If you have one of those, donate it. If you have actual surgical masks, try to donate them. Really, for people out and about, those homemade cloth masks that people are making, that is a perfect place to use them. And, I've encouraged my mom and her friends, they've been making these masks. Please, if you're making those masks, hand them out to the folks that are going out to the store, that need to go run an errand or go get their medications and go home. That's where we should be using them. They're not really useful in a healthcare setting. If we have the alternatives, they don't filter out the virus particles. But what they are good at is preventing someone that might be an asymptomatic carrier from coughing and spreading their germs everywhere. The other thing I'd like to address that I'm seeing a lot of, which is very frustrating, is please don't wear gloves out in public. Most people who wear gloves are touching things and not washing their hands in between. And those gloves don't magically not carry bacteria or viruses. They still are contaminated. And if you touch a counter that someone coughed on, then your purse now is contaminated. You touch your purse, you touch your face, you touch your doorknob, it's contaminated. You have to act like your gloves are just your hand. So you need to wash your hands really good. That's more important. You won't find me wearing gloves out in public, even though I'm very good about knowing what to touch and not touch because I use gloves every day at work. It's a very bad idea. Your average person will get this false sense of security, and then they'll start touching everything. They're actually more likely to infect themselves. Also, when you wear masks out in public, folks, you have to have it over your mouth and your nose. If you're not covering your mouth and your nose, you're not protecting yourself or anyone else. You're still going to spread it if you sneeze. Don't pull the mask down. Don't wear it down here if you need to get a breath. Don't sit there and rub your nose and then put the mask back up. It defeats the purpose of the mask. And I can't even tell you how many people I've seen when I had to go to the grocery store that are doing stuff like that. I mean, we talk about it and it's just crazy. My other people I work with will go to the grocery store and see people wearing oven mitts or a mask down to here or gloves and then touching everything. And it's like, you're actually causing more harm than good. So if you do wear gloves, be mindful of what I just said. If you're wearing a mask, please wear it correctly, so that you're doing the best. And obviously, if you can, stay home as much as possible. I know that's hard. A lot of folks have lost jobs. A lot of people are furloughed. It's a really rough time. I'm thankful that I have a job right now and that I'm able to employ some people. It has personally hit my family. I have relatives that are out of jobs, and it's terrifying right now. And so I know it's hard, and people are having anxiety, and it's rough. And every little step you guys do makes a huge difference. The sooner we can get this curve flattened, the sooner we can get back to a more normal life. But realistically, we're probably not going to get back to normal life until mid or late May at the earliest, just realistically. So that is my brief thing. I know a lot of you guys wrote a lot of stuff. I'm on my tablet today. Oh, I wanted to show you one other thing before I end here. We are reusing our masks in healthcare because we just don't have enough. And I thought this would be interesting to show you guys. I took a picture of our setup. So I have only 40 N95s total that fit me. My hospital did not have the type of mask that fit me. I was able to find them. I've shared a few. So I guess I have less than 40. So I bring my mask home, and there's several methods we've been using to try to sterilize masks. One was UV that warps the mask and destroys them. Another method people use are to put it in the oven with a certain temperature and let them dry out. I don't like that method because it can mess up the mask too. I've seen that personally. The method that a lot of us are using, and hopefully you can see this on my phone. If you can see this, this is a picture of in my garage. We have a pegboard that we usually put tools on. What these little things are paper bags with clips. And I put my masks in there and I date them. And we hang them out there and they dry and they sit there for like a week. Theoretically, the virus is going to die on whatever it is, anywhere from 4 to 7 days. I then take these bags and I put them away for however long until I go through a bunch of my masks, and then I can open these up and reuse them. And so theoretically, they should be clean because the virus has died off. That is what we've resorted to in our healthcare. It's a really scary and trying time. But there's a lot of innovation coming out of this, and I love that I'm in the field that I'm in because it allows me to have the tools to think outside of the box and MacGyver a lot of stuff. And I feel like I'm quite uniquely prepared for this as an ER physician. So again, guys, that's about it. I just wanted to show you some stuff and update you. I'll try to update again probably Friday. I'm off a lot this week, so but I'll try to update every Friday or Saturday in the evenings like this. But anyway, that's it, guys. Thank you so much for tuning in. I'll have a video tomorrow, totally unrelated to coronavirus. I'm gonna do my FabFitFun edit sell goodies. But yeah, thanks, guys. I really appreciate all the well wishes. We are doing our very best to stay safe, and I wish everybody else who follows me in healthcare to stay safe and healthy, and everybody else. This is a really trying time, and this community is so very important. And I thank you guys so very much. All right, bye, guys.